Well, now that marijuana is a legal recreational drug here in Illinois, we need to be mindful of our furry friends.
Here with the University of Illinois College of Veterinary Medicine is Dr. Caroline Tanazzi, and you have all the information, apparently, about what we need to be looking for and mindful of when it comes to marijuana and our pets. This is not something I ever would have thought of, but you guys see this.
Yes, we do. Yeah.
Well, now that it's legal, what kind of things do we need to be mindful of when it comes to our pet?
Sure. So dogs and cats can both be exposed to it. Dogs mostly when they eat it, either the product itself or it's in food or edibles. Cats when they ingest this or inhale the smoke.
Really? Why would the smoke not affect the dog as much?
I don't know that we know that quite yet, but it's reported in cats most of the time their exposure has been through inhalation.
Interesting.
Now, there's been lots of research about what does or doesn't happen to humans. What does or doesn't happen to our pets when they're exposed to marijuana?
Signs in dogs would include, one of the main ones is they dribble urine. They become unsteady on their feet. They can get dilated pupils. They may sway. We call it ataxia. They may get really weak. In severe cases or large ingestions, they'll have a really low heart rate and they can become comatose.
They're not rifling through the pantry looking for Cheetos.
No.
Okay.
Cats will act like they're hallucinating, so they'll be acting maybe quiet in one instance and then suddenly turn on a dime and act like they're seeing things and act spacey.
Wow. Okay, you mentioned edibles, so I'm like automatically just thinking about pot brownies.
Yes.
And I'm thinking the pot mix and chocolate are really
terrible
combinations for our pets.
So the times that we found that ingestion can be the most dangerous is when they consume it with something else. So it's they call it co-intoxication. So the more severe cases that we've seen, it's been in either oil or butter, because they don't really know the exact concentration of the THC in those products because it's fat soluble. And so if they either eat the butter or the oil itself, or they eat something that is made with it. So brownies being one of them, cookies, etc. And we can't really, our dogs don't really eat just one. So
of course not.
They eat every one available.
All of it, correct. So the co-intoxications that we see, if it's with chocolate or if it's candies, they're made with xylitol. We can see xylitol can be dangerous to dogs as well.
Now, let's say this happens and someone is aware that their pet has gotten a hold of this. Sure. What do you do?
Sure. We can do what's called decontamination measures for the pets. So we can either induce vomiting if the conditions are well. We don't recommend people try to do that at home. There are not necessarily specific antidotes for the severely affected patients, but there is something called intralipid therapy that we can use IV that could act like a lipid sink to help draw the toxin out of their body. Otherwise, it's supportive care. Sometimes when their heart rate drops or they become comatose, they just need time in the hospital and fluid therapy, etc.
Yeah, so if you think your pet has ingested anything, come to the vet clinic. Go to your veterinarian.
Yes, correct. Yep. Okay. You can always call the poison control hotline if there's any question about what to do, but for the most part, we would recommend your pet be evaluated.
Talk to me about the national research study that you're heading up.
Sure. I'm part of a multi-center study that is trying to validate a test that's trying to measure the metabolites of THC in urine and serum and blood, essentially. The test that's available for people right now, it's a little card, and it's oftentimes negative, at least when we're measuring it in dogs. So we're trying to validate a test that you can do to try to confirm or deny that pet's been exposed.
Which would help you guys out.
Correct.
Sure.
Yes. Oftentimes we're seeing pets, we're not sure if it's an intoxication or if it's actual central nervous system disease. It would be very helpful.
Yeah, we talked off camera, but you've seen a little bit of an uptick in people bringing in their pets.
Yes.
And we're what, 10 days in? So I'm sure you'll see a lot more of that. But
hopefully not.
Yes.
We just recommend try to keep it separate from your pets. Don't allow exposure to it as best you can.
How about you keep it in a sustainable container so you can get it the common ground?
As long as the dog doesn't eat it.
Wow, exactly. Connection between segments is unbelievable.
Tying it all together.
It's well done.
You're welcome.
If you'd like more information on what to do if your pet happens to get into edibles or marijuana of some sort, you can go to CILiving.tv and we'll connect you right there.